Welcome to Caucus Connections, a podcast with the Kentucky House Majority Caucus.
I want to welcome Melanie Moch to Caucus Connections. She's with the Kentucky Hospital Association and will be talking to us today about their COVID-19 informational dashboard. How are you today, Melanie?
I'm great. Thank you so much, John.
Talk to me a little bit about yourself first. What's your title? What is it you do with the Kentucky Hospital Association?
So I am actually the Vice President of Data and Health Information Services at Kentucky Hospital Association. I've been with the association now 10 and a half years, and my job really focuses around hospital data. At the Kentucky Hospital Association, we actually collect a lot of the administrative claims data for all the hospitals in Kentucky based on a contract that we have with the Cabinet for Health. So we've been in the hospital data world for many, many years. And when COVID hit, it just made sense that we got into this data world too. So with COVID, I actually work with the Department of Public Health and their entities on collecting the COVID data that was required by hospitals to report on a daily basis. So all of that work, again, just falls right into the data program that we have at Kentucky Hospital Association. We also work a lot with a quality program at Kentucky Hospital Association, and we collect data on that standpoint too. So I kind of have a wide variety of things that I do at the association, but it's all data related.
You put together this dashboard, and it goes out across the state and out to anyone that wants to view it. Talk to me about the process of putting that together. Where do you start, really? You use to compile the dashboard?
Absolutely. So first I would like to give with her idea to come to the Kentucky Hospital Association with this report card that she had seen in another state. And she said, can KHA produce something? Give recognition to her for the idea. So what we did, we needed to really create a one-page document that really gave what our state was. And so I started looking at what data could we really put out here that people would understand, because we wanted to make sure not only our hospitals, what was most important? What are we hearing in the news? What are we hearing that people are really wanting to know? A lot of that was around beds and in the hospital or in the with COVID-19. We've heard that a lot in the we actually have possible. I actually use two sources of data. The first source is with the Kentucky Department of Public Health. They actually have a website that has a lot of this data on there, but it's kind of a seek and find. You have to go search for it. So I do use that total number of tests that have been completed, total positive tests, the 7-day rolling positivity rate, the age of positives, and the age. The bed data we actually collect from our hospitals, and that is the data that we are public health to collect that data through a survey every single day of the week, including weekends and holidays.
I was about to say, do you put out this dashboard every day?
We do put out the dashboard every day. It's actually just a weekly dashboard that we produce every Wednesday based on the previous view of where we are today. Now, on the website with the Kentucky Department of Public Health, they do have numbers out there every day. So if someone wanted to are looking at that. So we may start producing it more frequently. But for now, it is a weekly dashboard that we produce every Wednesday.
And I think that's something I want to talk a little bit further. Coming directly from hospitals themselves, aren't they?
Directly to the public health or through the survey with the hospital and ICU beds. That data is
or just in general, what's available at that particular time?
They're actually both. That is one thing that we do with the hospital beds, and I'm going to go with ICU beds specifically. We do give the total number of ICU beds current COVID related.
For any reason.
Wanted for any reason, because as we started opening back these early elective or the elective procedures, they could be non-COVID related. New beds that are in use, and then we do say specifically how many of the patients are specific COVID patients that are in ICU beds, and we make sure to put it on our dashboard, because that's the first question people usually ask is, so we are highlighting that on our dashboard.
And that leads really well into my next question. You up. It seemed to me that our original mission in dealing with COVID-19 was to stay home in the curve, overwhelm hospitals. Did we do that? Do you feel like that was certainly a at least?
I think with the information we had at the time, I think it did. On things that we saw from other states, data that we had from other states. I think what we did and really pushing that curve of encouraging people to stay home, I think we met that. Now, since we've opened the procedures back up, since we're saying that it's okay to come to the hospital, because what we didn't want to do is for people not to go to the hospital COVID, but we want to ensure patients out there, it is safe if you are having issues and health concerns to go to your hospital and get dying from it. So we want to encourage people to know that it's safe to go to the hospital and get,
because and like you said, unknown. But now, as far as
they keep an eye, making sure they have bed availability, making sure they have additional beds if they were to hit a surge. They are looking at that on a day, sure that they have everything they need in place to treat our patients.
And this is my last question. This kind of wanted to finish on is, want people to take away from this info. When you're compiling this every week, what are some of the their checkups and for things that they need? What in general do you feel like is the word provides Kentucky?
Really what Kentucky looks at today. Again, there's a lot of not what it looks like in other states, and on what Kentucky is doing to keep all of Kentuckians safe, to make sure that they understand that it is okay to go to the hospital. Looks like, and that
and from a slant
and use the and that's why we're using these two true sources of data that is coming directly from the hospitals, so that the data out there is truly representing what Kentucky looks like.
Thank you so much for sitting with us today and talking with us, Melanie Moch with the Kentucky Hospital Association. Thank you so much.
Thank you.
To view the Kentucky Hospital Association's weekly COVID-19 dashboard, visit them online at www.kyha.com. That's www.kyha.com.
You've been listening to Caucus Connections. Tune in next week for another episode from the House Majority Caucus.